Please tell me that I can't, that I won't, that I fail, that I'll never make it out, yeah. Please tell me all the bad, never good, fill my head full of every single doubt.
The World Health Organization just passed their guidelines concerning GLP-1 inhibitors, i.e. Ozempic, Mounjaro, Wegovy, etc. So what does this mean for you and obesity rates altogether? Originally formulated to treat type 2 diabetes, GLP-1 inhibitors blew up in popularity a few years ago as increasing numbers of Hollywood celebrities cast these drugs as their secret weapon to help them lose weight and keep the weight off. Since then, GLP-1 inhibitors blew up in popularity amongst regular people, creating a lot of debate concerning its safety and potential long-term ramifications. Welcome to the Workout Nerd Out. I'm Julio Lopez. I'm a certified strength and conditioning specialist with over 10 years of experience in personal training, and I also have my master's degree in nutrition. Contrary to popular belief, GLP-1 inhibitors are not magic. You still have to eat healthy and exercise consistently to see real and sustained weight change. With obesity rates on the rise in the United States and the rest of the world, it is increasingly important that individuals take action in controlling their weight, especially since deaths related to obesity are on the rise. Let's take a look at what the WHO has to say. According to the World Health Organization, obesity is characterized as a chronic disease with high potential of relapsing and requires lifelong care. This suggests that weight gain is more easily treated when action is taken early, as opposed to waiting to the point where one is obese or morbidly obese. In these situations, that could mean that GLP-1 inhibitors would not even be needed. Additionally, behavioral treatment, along with medical and surgical interventions, are also viable in helping people gain control of their weight issues. The manner of treatment prescribed for an obese person depends on an individual. It doesn't mean that GLP-1 inhibitors are automatic. For example, some individuals are perfectly capable of losing weight with the help of the GLP-1 inhibitor alone. Meanwhile, others still require additional assistance, such as behavior therapy, along with a medication. The way that GLP-1 inhibitors like Ozempic and Mounjaro work with helping people lose weight is by managing hunger. People feel satiated for longer periods and feel a sense of being fuller sooner, which means decreased overeating. Weight gain happens when a person is consuming more calories than are being burned over an extended period. And by controlling hunger and overeating, this increases weight management and weight loss success for those who generally have difficulty with their eating habits. Treating individuals to lose weight with GLP-1 inhibitors like Ozempic and Wegovy and Mounjaro, etc. is not without its challenges. As sports commentator and Hall of Fame tight end Shannon Sharpe once said for athletes, the most important ability is availability. The WHO, or World Health Organization, mentions that to effectively battle against obesity with the help of drugs like Ozempic and Wegovy, Mounjaro, there has to be enough supply for the larger population to be able to have access to these drugs. Along with the availability of GLP-1 inhibitors to fight against obesity, the WHO, the World Health Organization, mentions that the drugs have to be made to be affordable enough so people in need of the drugs are not being priced out. When Ozempic's popularity started to blow up, it was about $1,000 a month for 4 weekly injections. Since then, different manufacturers have worked with insurance companies to make the products more affordable. And more recently, President Trump has proposed to companies that they continue to make these drugs more affordable so that they can combat obesity in the United States. The WHO mentioned semaglutide, the main active ingredient in Ozempic and Mounjaro, are slated to have their patents expire in 2026, which should allow generic brands to hit the marketplace and lower costs, thus expanding the drug's attainability across a wider range of potential customers. Having a greater supply of semaglutide GLP-1 inhibitors also helps to better manage demand and ultimately lead to a drop in prices. In general, the benchmark for labeling a person as obese is when his or her body mass index is at 30 or above. The WHO, World Health Organization, guidelines on GLP-1 inhibitors mentions that fighting obesity before approaching this threshold or immediately upon getting there make the weight loss process less difficult. Since the cause of obesity is based on a wide variety of factors, the sooner a person acts to manage their weight, breaking those unhealthy habits behind their weight gain are easier to be broken when action is taken earlier. GLP-1 inhibitors are not a magic bullet that are immediately going to make fat melt away without requiring any work on your behalf. The WHO and most physicians who specialize with weight loss agree that increased physical activity through exercise would serve as a beneficial lifestyle change for those looking to lose weight while taking these drugs. Adopting a weight training program helps to speed up the fat loss while supporting muscle maintenance or even growing more muscle mass. Additionally, resistance training also helps individuals to increase their bone strength, which is really important for those over 30 and especially women that are pre and postmenopausal. For weight loss to sustain long-term success, the WHO guidelines on GLP-1 inhibitors encourages establishing an ecosystem that includes community building, education, and therapy support to work in addition to widespread access of the medication. Having a strong relationship with pharmacological innovation with holistic therapy is necessary, and of course, it doesn't help to criticize or mock people for taking GLP-1 inhibitors. In conclusion, globally, over 1 billion people are obese, and the WHO, the World Health Organization, predicts that this number is going to surpass 2 billion by 2030. In the United States, about 40% of adults are obese, in which men and women between ages 40 and 59 lead within the age groups. While President Trump opted to withdraw the United States from the WHO, his administration has taken steps to make GLP-1 inhibitors more affordable and accessible to the public, recently setting up a deal with Eli Lilly to make Zepbound and Mounjaro potentially cost less than $200 a month. While the long-term impact of GLP-1 inhibitors on global obesity is yet to be determined, early data indicates that they may have a substantial impact on lowering obesity rates. Until then, whether or not you're taking Ozempic or whatever, it's still important that you are consistently eating healthy and exercising. So that does it for today's Workout Nerd Out. Thank you so much for joining me. If you have any questions, feel free to leave it in the comment section, and don't forget to hit that like and subscribe button. Also, if you know anyone who can benefit from this information, please share it with them. Until next time, I'll see you on the next Workout Nerd Out.